Good afternoon, everyone. It is the top of the hour, and we will start with Journal Club. So my name is Dr. Diane Sanders-Cepeda. I am hosting today's Journal Club, November 17, 2021. And we have a special guest today, Susie Jensvold. And I don't know if I said your last name correct, Susie, but we'll correct it later in the presentation. Today, we're going to be talking about nursing home staff perils. And, I wanted to start, as we normally do, just going through the state of the state and then get into a really deep conversation with Susie about what we're seeing in the nursing home and what we're facing on a day-to-day. And we're going to have time to have an open discussion. So everyone's voice, if you want to share what your experiences are, we'll have time for that as well. So in looking at just where we're at as a country, I think we are much better than where we were this summer when we first started seeing the surge from the Delta variant. And looking at our 7-day moving average, we have a positivity rate of 9.9%, with the daily confirmed cases still being too high, well above 90,000 for the country. And why that is worrisome is because of this map that I'm showing you now. When the CDC is tracking the data, they're able to look at the level of community transmission at a county level across the country. And we see that where we saw the surge in the Southeast over the summer, many more places in the Midwest and now in the Northeast are having those high county transmission rates. And if you recall, from some of our prior conversations, what we know to be a fact is that our facilities follow what's happening locally. So if we're seeing high transmission rates in and around our buildings, we're going to see COVID come in. Fortunately, in the state of Florida, many of our residents are vaccinated. We still have a challenge when it comes to our staff. And, we do know that, as I said before, Florida's doing a lot better than where we were in the previous month. So in our breakdown of our weekly report from the Department of Health, our positivity rate in Florida was 2.5%, which is just amazing. That means that, when you're looking at those total cases, we're running on an average somewhere around 10,000 new cases. And I think we really need to just prepare ourselves because, as I said, what we are seeing in Colorado, now in Nebraska, in California, we're seeing some local hyper acute local outbreaks in buildings, and it's starting to see that trend in Michigan and now in the Northeast. So we have to be prepared that we may see a resurgence of this come the winter. The problem is, what we are also experiencing is a multitude of challenges when it comes to keeping our facilities staffed. We have been monitoring this for, I will say, over the last year quite closely, but I wanted to really understand what is happening in our buildings and to have someone speak to what our nurses are seeing on a day-to-day basis and how they are living and dealing with this. So I'm going to have with me Susie, who is FDANA's president, and I'm going to ask Susie to come off mute and introduce herself. And I am going to stop sharing so that she and I can have a real conversation without all the slides in the way.
Good afternoon, everyone. My name is Susie Jensvold. I work for part-time for Consulate Healthcare as a clinical educator in doing different programs. I also have been a DON. I've been a regional nurse. I do consulting work at a facility also in Sarasota, Florida. So I am in and out of facilities, assisting, educating, and down in the roots of everything. So um, it's a pleasure to be here today and to share, what I do see and what, I hear is occurring in the facilities.
And Susie, can you tell us a little bit more for the FAMDA audience and some of our audience nationally? What does FDANA do?
FDANA is the Florida Organization of the Directors of Nurses for Long-Term Care. We are the Florida group for NADANA, which is the National Association. Our group is for nurse managers, nurse management, DONs, ADONs, unit managers. It is for, we do education, we do support. We do have a conference in March this year. Is going to be our first in-person conference for 2 years. It was not able to be held in person. We did, virtual, but we're all excited that we're going to be able to, be together. NADANA had their conference in August, and we were up in Niagara Falls, and that brought in people from all over the United States, except for Hawaii. Hawaii has a chapter, and they were not able to attend this year. But it was a great group, and we learned a lot from each other at that conference also.
Thank you. So Susie, I know you and the directors of nurses who are on this call, the administrators, the medical directors, our attendings, we're all feeling these stressors. I saw an article where a few months ago where it said ghost towns, nursing home staffing falls amid pandemic, and how it's impacting us even getting admissions into the buildings because we're not staffed. What would you say are the drivers behind the staffing crisis that we're currently seeing? And I want to just raise the issue that when I was doing some research on this over the past few months, it's funny that we've always talked about staffing challenges. In my lifetime as a physician, we've always, we're looking at staffing challenges, and it's very important to make sure everybody understands this is so much worse than I think we ever imagined. So just tell us what you're seeing.
At a facility level, we've got burnout. The nurses and CNAs, for a year and a half now have been, wearing masks. And, previously they may have even had to wear gowns and masks, and try wearing those all day long. You've come into the building, you have a mask on, you have your mask on all day until maybe you can go outside and take it off and take a deep breath. And it's difficult. It really is difficult that, we don't have enough staff. People are not, they're leaving. I have never seen so much turnover of DONs like I am seeing right now in open positions. They're leaving, they're tired, they don't want to be a DON. Our DONs and unit managers are out on the floor being staff. They may be on a med cart. Today, when I walked in here to the facility I'm at, one of the unit managers is on the med cart because they had a call off and they didn't have a replacement. And she's on the med cart. Sometimes they have to come in and be CNAs because we don't have enough CNAs. But the burnout, and I also, at the beginning of all of this, we saw where quite a few people were leaving to go do travel nurse. They were paying, the nurses quite a bit of money. They paid for them to go to Texas. They went to California. One of our facilities, we lost the DON. She went to Texas and, was working in a COVID unit, and she was being paid quite well. She figured if she went and worked for, I think, 6 weeks, she wasn't going to have to work the rest of the year.
Wow. I know there's been some dramatic increases when it comes to agency nurses. How is that impacting our facilities?
Well, some of the nurses have left to go to agencies because they can get paid more money. But, then the agencies have increased their prices and it's kind of a price war. They may have a contract with one building at a certain, rate. And then at another one, they may charge more. And, they only have so many nurses too. And so we try to use, if you need the agency, you call agency, you may get one booked and they, may work, they may call off, we have agency nurses and CNAs. Of course, you don't want, we would try not to use them. But if you have to, you have to.
Do you know of any facilities that had to stop taking admissions because of their staffing challenges?
Yes, I am aware of that, and I know that is occurring.
Yes.
We can't bring them in, to provide, to take care of them. And unfortunately, even if we're admitting, with our staffing challenges, that still is, a concern, and it is an issue. To make sure that they're getting the proper care. And, you do get the complaints from the residents and from family members. And now with visitation, we're dealing with opening back up for visitation, and making sure that, we're doing that correctly.
Yeah, let's talk about visitation. I know that CMS dropped that pretty late. like they do. And what do you even do to prepare? Like if I was the medical director of that facility and I know my director of nursing, we would have all panicked. We would have been like, what? So how do you prepare for the change, that dramatic change? Because someone the next day can say, well, they opened up visitation, so now I want to come in.
Exactly. And, like you mentioned, they dropped it at Friday afternoon, like they always do.
That's the best time to drop everything.
Yes. So if you happen to see it before you left your office, you maybe could have printed it off and read it and reread it and reread it. Because with those memos, you usually have to read them numerous times to pick apart and to totally understand, the directive. And as usual, it's not, it's kind of vague, what they have communicated. So you have to really, review it. We sat down as a team and reviewed it on Monday and put together, the guidelines that we were going to put in place for our, opening up the visitation. And then, yesterday on Tuesday, we, started filtering it out and educating the staff and, allowing the visitation. Today, when I came in, there were several visitors already here, coming in, being screened, going and visiting their family member.
Yeah. Let me ask you this. So you mentioned staff burnout. And I want to get back to that in a minute, but I want to talk about the vaccine mandates. I was looking at the AARP nursing home COVID-19 dashboard, and I know that, in Florida, I think 59% of our staff may be vaccinated. We still rank at we're 46th in the nation. And it was commenting on the fact that as of November 10th, our staff vaccinations were up 5%. But how big of a problem has that been with keeping staff, with the vaccine mandates?
Well, I think most staff, I think, have kind of been waiting to see exactly, what's going to be, if it's going to be mandated, and probably waiting to the last minute, to make a determination. And we feel that, we're going to have more people take it at the very last minute. We've got a clinic planned for the one facility for staff and, boosters for the residents. But, we're educating, we're doing individual education one-on-one. We've got 44% staff that are not vaccinated. And that's a campus wide, that includes dietary, housekeeping, laundry, and frontline staff.
Yeah, I think a lot of people don't understand the uniqueness of post-acute long-term care. That when we think of our staff, we have the nurses, and they are like invaluable, like they're amazing. But we also have the dietary staff, that nutrition and laundry and custodial. And I don't know, how has it been trying to get them to become vaccinated? Those who may not be on the clinical side of things.
It's challenging. Like I say, we're really doing one-on-one education, and working with them to talk with them. And if they want to get the exception, they have to have that completed and turned in. I haven't seen any yet, but I am aware that some people have asked about it.
Now, I had a question about the impact that we've seen as far as COVID infecting staff, our nurses, our other staff members in the building. It hasn't really been talked about enough. And I'm wondering if that's some of the reason why we're losing people to, like, maybe they are too sick to come back to work, or they just decide to go to do something different. Have you seen any of that?
I haven't seen any of that. No, I haven't. I think, as any company or anybody, we've lost staff to COVID. And of course that affects, the rest of the staff. But I haven't seen where they've been too sick to come back. At this point, it's not that it's not there, but I haven't seen it.
So let's talk about that day in the life. And you've mentioned what the directors of nursing are having to do. Can you go and share with us some more of that and explain to us what that really means for with a director of nursing who has so many responsibilities, is now the CNA or the passing meds on the floor, or that nurse, the unit manager? What does that mean? What happens in that day of that life?
Well, when they come in, it starts before they even get to the building. The DONs usually have their cell phones, with them at all times, and it can ring all night long. But, you're notified that you don't have a nurse, so you're notified, you don't have enough CNAs, and so you come into work, and depending on what situation or where you're going to work for the day, the biggest, then you don't have the DON doing her responsibilities, directing and leading the department. She's out there, working on the cart. The unit manager that was on the cart this morning, we were able to get someone else to come in and take the cart, but she also is the wound nurse. So now she's making wound rounds. So she hasn't even, been to her unit, because she wasn't on the cart on her unit. She was on the cart on another unit. So, her unit, she's going to get there later this afternoon when she gets done with wound rounds, to follow up and to make sure, the residents on her unit, have what they need, and if there's any issues or concerns. And a director of nurses, you could work as a DON all day, go home for a couple of hours and get notified that you're down a nurse for 11 to 7, or even at 7 o'clock. There's numerous times that, the DONs and the unit managers probably, have worked 16 and maybe almost 24 hours straight during this time. And that's why, that really, leads to the burnout and, being tired and, not able to take care of themselves.
Yeah. Yeah. We're trying to address burnout at so many levels. And I don't know how you become the everything to a building and not become burned out. I just don't understand that. Um, and I enjoy, like, I think I would work with my director of nursing, we would talk, it felt like every hour some days, chatting on the phone, when are you getting here? What's happening? What's going on? But to then have them try to do the CNA's role, what are we doing to try to recruit more people to become CNAs in the state of Florida, at least?
Well, the state of Florida approved the personal care attendant program, and that has become a permanent program, for the state of Florida. I do know of, that's what I teach for consulate healthcare currently. I do the via Zoom webinar every Tuesday. I am teaching it. Currently, it's 6 hours of classroom. Now with the now that it's been approved, it's going to have to go to 10 hours. So we have to do 10 hours of classroom training and then do 6 hours of hands-on competency training for them. Some companies, consulate, like yesterday I taught and I had 13 different buildings on. And I probably had about 18 new PCAs on that webinar at different buildings. And so then after I teach, then they do their competencies and their hands-on training. And then, we put them to the floor. As we're hiring them, we're interviewing and talking with them about, as a PCA, they can work, 4 months as a PCA. After 4 months, expectation is that they then would challenge and take the CNA test before the 4 months is up and become a CNA. It's mentoring, it's working with them.
How many people have you been able to get through this program?
We've been doing it for a long, over a year. I've been teaching it. So, and I, at this point, I really couldn't tell you because unfortunately, with the burnout and with, the turnover, we've had quite a few pass and have stayed as CNAs. The sad part of it is we may train them, pay them because we're paying them to take the course, and then, paying them when they are working. But we may pay for them to go take the test. We do pay for them to go take the test. And then, they become a CNA and then they can go down the street maybe for more money, go to another facility and receive, a higher wage.
So I know that, I know that there's a lot of variability state to state on how these programs work. I know that with Florida, we had a certain amount allocated from the American Rescue Plan Act to us. And recently, November 4th, there was an announcement that the state had approved $99.5 million to its short-term financial relief for Florida nursing centers. What does that mean as far as education, as far as hiring? What would that mean to, let's say, of the facility up the road? What will they see?
Well, I really couldn't tell you. I mean, what I've heard, I'm not sure how much money is really going to, be seen in the buildings. I think they'll see some, but again, you've got the cost of, running the facility, for everything. It hopefully will help with wages if you're looking at, increasing your wages and, hiring and education for our, for the staff. But I'm not, I really don't know exactly how that's all going to come out, Diane.
Yeah, and if anyone who's on the call, if you may know, because that's the one thing that worries me. I don't know, like, how do I get the funds where they are most needed? You know, I want to make sure that if I'm putting my mother into a facility, that there's people who could take care of her, or if there was somebody who was available. You know, I have plenty of relatives who are in buildings that I used to service right now. And you hear it, you feel it, you know, that from the staff there, when they call you, they're like, we just don't have enough. When are you coming back to the building, kind of thing? And there are not enough clinicians, there are not enough nurses. So, I mean, I just don't know what's going to happen. We keep trying to find out on our side. And it's something that we talk about with at the national level with other states, probably on a weekly basis. Like, how do we tap into those funds for our facilities, especially given that we may be facing another outbreak soon, and the flu, you know.
That's true. That's very true. I don't know if you've probably heard about the Healthcare Workforce Coalition in the state of Florida. Florida Healthcare Association, the Hospital Association. There's a coalition, and they have met, and they're working on identifying, because it's not just long-term care. It is hospitals, home care. It affects all of us in having enough staff for taking care of our residents and our patients. And so I'm really watching and listening to what is being presented and identified from them, because it is everyone that's involved.
Well, I tell you, I make people may think it's a joke, but it's the God have his truth. The infrastructure, post-acute long-term care infrastructure, does keep me up at night. I usually wake up and I'm reading some random article at 3:00 in the morning, trying to figure out what do we need to do to shore up our infrastructure. How do we work together? I think to your point, there are a lot of partnerships and commissions that we've all been trying to lend our voices to, those things, beating down the Department of Health's door. How do we work together with, for the Florida Medical Directors Association, how should we be partnering with FDANA? What do you guys need from us to make sure that your voices are being heard?
I think, it's great community, this platform, and, having the calls and communication, to know what's going on, and, be supportive. Like I say, with the Healthcare Workforce Coalition, we really need to, communicate with them, to listen to what they're identifying, but to also, speak to them, and talk with them about, what we are seeing and what is occurring.
So at this time, I would ask you to take yourself off mute. You could ask Susie anything. You ask me anything too, but we definitely want to hear if you have any experiences that you want to share, anything that's happening in your facilities, please, let's hear about it. Let's see how we can talk through it and what we can do to help each other out.
Thank you, Susie, for sharing. As I stated earlier on, I am the corporate nurse for Royal Meridian, and we do have like 5 facilities under our umbrella, and we are experiencing the exact same thing that you said. I echo every sentiment. DONs on the floor, everything is the exact same scenario. So they are leaving, and we are training, and I'm the one who teaches the PCA class, and evidently once they become, and next door is offering them more money, and they leave. And so what are we going to do? They're free to go. And so we watch that, we train people, we take new nurses, And as soon as they get more opportunity, they leave. It's their market. They name their price. They are overbearing. They're driving the DONs crazy. And I don't like using that terms, but that's really what's going on. They make their decision as to when they're going to work, which cart they're going to work. They do not want to go to a different unit. And if they have to go, they'll complete that shift, and the next shift, they just don't show up. This weekend, one building lost 2 nurses. Now you can imagine we're losing when we don't even have. Right now, I'm looking at an email where one facility is needing 33 shifts to be covered this weekend. And as Susie stated, agency do not have any to give. And our staff left to go work for agency for more money. When I visit the facilities, they ask me for, you have CNA, you have LPN asking you, they fix their lips to ask you for $35 an hour. Okay. And so where is the money and to be able to pay? So what we've been doing is that we give gift cards, we give a temporary increase in their pay rate. It's temporary because we won't be able to survive if we're paying CNA $17 and then we're paying LPN $35, we're paying RN 40 plus. We won't be able to survive. So we're doing it, we had them sign something that this is a temporary movement. And then to try to attract new staff, they're telling us, we say, okay, to the RN, new RN, okay, we're gonna pay you let's say $31, but because we have this temporary wage, we'll give you 38. And they say, no, you need to give me at minimum 35 for me to even come on board. So what I'm going to participate in this temporary rate, but when you take it away, I want my base to be 35. So it's very, very hard. I mean, the DONs I'm basically in their building as much as I can to provide emotional support, do whatever I can for them. And the visitation that opened up, of course, everybody under the sun had to update their policies. And I can tell you, I was in one building yesterday, the families, everybody's already coming through. And so what it's doing is that it's creating chaos, mayhem, because you don't even have the staff to monitor those visits, really. It's just, I'm not understanding what is really happening. Too many changes too soon. Then you have HR trying to deal with this vaccine mandate. Evidently, we pushed that toolkit. I call it a toolkit because in there, it has a letter after we approve you. It has the policy. It has the appendix for the vendors, the letters for the staff. Also, we gave the exceptions, whether it's going to be medical or religious. And so, and we saw a couple of that. I know, Susie, you said you didn't see anything come up for the religious, but we did see a couple of those. We saw that came through, and we have to honor that and then give them testing. And then there's the union wants a meeting. It's chaos. It's like your time that you need to at least facilitate, like care for those patients at the bedside. You got to deal with the nuances that are coming places.
As you're getting the clinicians in the building, if I'm the PA, the nurse practitioner, the attending, or the medical director, how do we support you with, maybe education? What do we need to do to help bring emotional health into the building? What can we partner on with you?
You said it. You said it. I think that it starts with our medical director. I actually had the pleasure of meeting you, Dr. Sanders, at FMC. And we bonded, and I was trying to get you at one of our buildings. So, okay. At Westwood. So anyway, yes. So it starts with number one with our medical director, right? So our medical director, if they can get more involved in that training and helping the staff cope with what Susie stated, with the burnout, and also a feeling to help them, because the DON, there's so much is expecting of her or him to do, and there's almost no time. There's really no time left to, foster that relationship, to let them know that, listen, we care, we understand, I'm right there with you in the trenches, I understand what you're going through. Sometimes the DON may not have that time to do that. So that's where our medical director, the nurse practitioner that comes to the facility, would give us that opportunity to talk to the staff and let them know that, we here with you, or we understand what you're going through. What can we do for you to alleviate that, so that they don't walk out? Because what we're hearing really is that they feel unappreciated. They're looking for that recognition on a daily basis. It's almost like you can't ask them to do anything extra. I know you asked this question earlier on. We had to twice stop admission because we didn't have staff. And we've put ourselves in self-moratorium twice, and because we didn't meet the numbers. And ACA still came through on complaints and still tagged. So it's a lot. And that's why the DONs don't want to be DONs anymore. So I've had 2 DON who quit on me. So, I had to go in there and be whatever I needed to be to get us through. So it's very, very difficult with the vaccine mandate. The fact that, it encompasses all the healthcare field. So really, I don't see us losing someone for somebody else. I don't see that, because next door it is the same requirement. So we thank Florida Healthcare Association for that. So that's good. That's comforting. And so we have that to deal with. And now we're dealing with the visitors that are coming through. And I'm going to tell you, we have ad out there and we don't have traction. We have one facility in Stewart, and we can call it desolate. We don't have traction. And weeks, we don't have anybody come through. Just maybe this week we start seeing small traction in nurses. CNAs are nowhere to be found.
We had a question. We had a question that came through the chat from Suzanne. As a manufacturer, what can we do to assist the facilities?
What can you do?
Yeah.
They can be, supportive, in education, and I know that, like Nerva was saying, the staff we need to show appreciation. We need to, thank them. It's a thankless job, but we need to thank them every day. And the medical directors and nurse practitioners, when they come in, to be pleasant, to be positive, to not be in a hurry, and rushing the staff. And the same way, with the vendors, if you have a facility that is utilizing your product, to be there for them, offer the education, to support them. Sometimes, the directors and nurses feel like they're just out there, and, they also need to have that support. And that's, what, like the corporate nurses, regional nurses, whoever, we're there to support and, to be for them and to help them.
Well, I will say that in the course of my career, I've learned so much from the CNAs who were doing bedside care, the nurses at the unit, the nurses passing the medications, and the director of nursing, so much. And whatever, I know as an organization, whatever we can do to make sure that we're there to help educate staff and educate the facilities, we're ready to do it. We have been able to stand up a vaccine confidence, staff vaccine confidence initiative. So we have, not only do we have videos that are available, But if you need someone to come into a building, we have different clinicians standing by to do it. You know, if you haven't seen a video that Dr. Hawk did, I'll ask Ian and Shane to push it out again because he wants to just talk to everyone. So we really want to do it because the impact, you know, if it's not for our nurses taking care of our residents in these buildings, this is their home. And that's what I think a lot of people, when you see reports in the media and you see, and I'm gonna tear up, sorry. When you see things coming through the media and those news stories breaking, they forget that this is that person's home. And the people who are there serving on the front lines, those directors of nurses who are willing to work any job in that building, they're essential. And they're doing something that is just heroic, and we need to always support that. So I thank you. And I thank you, I'm a mess now. So I thank you all. You know, if you want any information on our Vaccine Confidence Initiative, please contact us. If you want any information on our clinical leveraging clinical staff engagement program, which we do have, please contact us, and whatever we need to do to help support the directors of nursing, support FDANA, FHCA, let us know, and we will be there. Thank you. Thank you all for attending.
Thank you.